I'm Rosanna, and I am a student organizer with Health Equity Circle. I had a background in public health before I started medical school, and so I sort of had a little bit of a larger picture view of what makes people healthy. So I felt like I really needed to reconcile the interest that I had in having relationships with my patients one-on-one, and also the parts of me that said that their health is more than just what we can provide as health professionals, as doctors.
My name is Lorelei Walker, and I got involved in Health Equity Circle in 2012. I was at the beginning of my PhD, and I was studying about the stress response system, and I was learning about all of these ways that activate our stress response system. So environmental toxicants, psychosocial stressors, lack of housing stability, food deserts, how all of these things press on us in a way that fosters chronic disease. And I felt this huge urge to push back on the system, to make the system work for people in a way that it wasn't working. I felt like a novice when it came to working with communities. And I got a flyer. And so I started to inquire more and realized that there was this pipeline to understand the tools of organizing in a way that can push the social determinants of health.
My name is Shannon. I'm a WSU Speech and Hearing Science graduate student. My experience with my mother was a healthcare nightmare. It was a mess. My mother was unexpectedly hospitalized, and I got a phone call that I needed to drive home and see her that night. She was dying, and she had a trach installed. She was unable to voice any of her thoughts, and the only way we could communicate with her in her last hours were through a rather feeble alphabet board that she used to repeat B and D. And my aunt and I spent the rest of that evening trying to decipher and decode what that could possibly mean. Though the care staff at the hospital was as compassionate as they could be, they didn't know how to see us through that communication gap. I think I felt angry that she ended up dying in a hospital with a tube down her throat, even though she had a do not resuscitate order. And angry because I was sad that she didn't have the dignity in passing that she wanted, and that she, that the healthcare system kind of turned its back on her last wishes.
I think we live in a pretty polarizing time now more than ever, and sometimes it can be difficult to have conversations across the aisle if we want to talk politics or talk about hot button issues.
So if I'm going into a community that I haven't surfaced from myself, am I just going to helicopter in, as we have a history of doing? Meaning, am I going to come in and tell the community member what they need in order to succeed and give them the data, and then I'm going to leave?
When we talk about community organizing through relationship building, the reason why it's important is because at the end of the day, we're trying to figure out what drives people, right? What motivates them to get up in the morning to do the things they do, what they are willing to work for, and what they get excited about, what they get mad about, what matters to them. When you can figure out what that is for yourself and what that is for somebody else, and when you can hopefully find some sort of middle ground there where, whatever it is that you're interested in is also what they're interested in, that's when you start really moving somewhere.
And in order to build that relationship, I need to understand and be able to listen to what that community member is saying to me. And that sounds like it's easy to do, but surfacing the self-interest of somebody else, building the trust, and then overlapping into what is shared interest is an exceptionally hard skill. It's one that you need practice, and you need space, and you need time to develop. And the Health Equity Circle gives us the opportunity to practice building those relational skills.
I was 20 at the time that she died. As I grew older and reflected on that experience, I realized that there was room for better training so that people in their last moments of life could communicate with the people they loved more effectively. And if we don't learn how to create and foster healthy professional relationship, and if we don't learn to organize ourselves, we become a cog in the machine.
Agency is one of the resilience factors. So if we think about all the stressors in our life, having agency and ownership over decision making that impacts us is a huge factor in lowering your stress response. So if you're going to fight against cardiovascular disease or obesity or diabetes, agency is one of those core resiliency factors that we have. So agency for community members means that they have the voice to go out and press back on the decision makers who may be making a decision that removes agency.
You know, I think these days in medical school, we talk a lot about physician burnout in our profession. We also talk about wellness, do more yoga, meditate, take time for yourself, exercise, do those sorts of things, and that can kind of, if you find some work-life balance. I would posit that maybe some of those feelings of burnout come from a feeling of problems being larger than yourself and larger than one person can handle, and feeling helpless in light of that. And I think what community organizing sort of brings to the table and what Health Equity Circle has sort of helped me to see is that you don't do a campaign with just one person, first of all. It's about building collective power and how to do that.
Before I had the skills or was introduced to the skills of community organizing and relational meeting, I would feel like it was impossible to do on my own.
But agency as a student, I think, is one of the things that often gets lost in the didactic curriculum. And so as a student, I'm learning about all of these psychosocial pressures and these social determinants of health that harm our communities. But what power do I have? I have all this knowledge to learn on it. Maybe it's someday in the future I'll be able to act on it. But I want to use that information now to do something. And what the Health Equity Circle did is it provided students a place to have agency in this process.
I might posit then that a cure to burnout, for physicians anyway, or for me personally, is this community organizing work. That gives me hope, that helps me have faith in humanity.
When I came back to school, I wanted a profession that I would enjoy and that I could go to bed feeling like I'd done something for my family, feeling happy that I'd contributed to my family. What I wanted as a young person was to change the world. And at this intersection, I see that they don't have to be mutually exclusive. If I've learned anything from being a part of the Health Equity Circle, it's that there's plenty of room for change, and change absolutely does happen.
I think luckily Health Equity Circle has been around for 9 years now, and so there are people who have been part of Health Equity Circle, have been touched by Health Equity Circle, that are now out in the working world, and they're helping me pave the path for my future.
And so what I would say is we need this to be in every single medical student curriculum, in every public health school across the board. The faculty members that I engage with know that this is the way to change the culture that we have going forward, to be community-centric. And so unless we provide these opportunities and these experiences for students, we're not going to get the outcomes that we desire.